Hey guys, Kim here, and you are tuned into Kim E, the Diabetes MP, a place where healthcare professionals can come learn more about diabetes management so you can increase your patient outcomes. Now, what we're going to be talking about for the month of May, because that's the month that we're currently in at this point, we're going to be talking about older adults and diabetes. Now, for those who don't know, May is Older Americans Month. Yeah, who thought it? But it is, all right? And so instead of just speaking through the lens of just older Americans, I'm going to really address all older adults and just the unique complicating factors and the different unique characteristics when you're taking care of the older adult that has diabetes. So throughout the month, I am going to speak a lot about education. We're going to talk about cultural considerations, addressing the unique SDOH of the older adult. And as you know, y'all know, I've spoken so much about social determinants of health because I really do believe that that is really what drives our clinical care, the non-clinical factors. So I have to address that with them. So that will be coming soon. But today I'm just going to give just an overview of the older adult that has diabetes, give you a little bit of stats, and then we're going to just talk about it at a high level. Now, before we get into that, I do want to insert a clip, actually a trailer from Shift Nursing over their documentary that they just launched in April. Now, I've made a whole video of my reaction to the documentary, and I'll link that here down in the description box, but I just wanted to insert a clip of just the documentary. It was a great documentary, and just want to give you a little taste of what it was about. And also encourage you guys to also look at it for yourself and view it for yourself. So we're going to watch that, and then we'll come back.
If you own a pair of Crocs, even though you know they're super ugly, you might be a nurse.
I'm Whitney Fear. I'm a psychiatric mental health nurse practitioner in Fargo, North Dakota. I'm Lakota. I grew up in the country on the Pine Ridge Reservation. I see patients across the lifespan for treatment of mental health conditions and substance use disorders.
I don't think she's ever given herself enough credit for the impact that she makes on other people.
Yeah, she's tolerable.
She is going to have vulnerable conversations with people in a way that makes them feel like they're cared for.
I always say it's the essence of Whitney. You have to just understand how really good she is.
Asking people how they want their care and what they think is possible, because that is communicative of respect rather than compliance.
Riding in my Indian car.
Okay, guys, I hope you enjoyed that trailer. Again, if you would like to watch the full documentary, I'm going to link it in the description box so you can go over, learn more about Shift in the documentary. So let's go ahead and get right into it. I'm going to give you a little bit of some overview statistics. Now, if you want to read more about this, you can pull the standard of care from the ADA. I'm going to link that also in the description box as well. If this is a population that you tend to work with, I'll be honest with you, this is my primary population that I work with. I've been working with this population for almost 10 years at this point. Actually more, because I spent some time even as a registered nurse working with the elderly population, but just not elderly population, the retired population. So this is kind of including all of those people retired as well as elderly as well, because, you know, people who are retired, people can retire like in their 50s, 60s, and, you know, they may not want to be considered elderly, but the older adult, okay? And so let me just give you some stats just so you know we're all working from the same place, but I'm going to read them off because I want to make sure I get them right. Over 25% of people who are over 65 have diabetes, and 50% of them have pre-diabetes. So, and this is also expected to rapidly increase in the coming decades. As we all know, we're living longer. You know, we're living longer than generations in the past. And so with that, common sense will tell us that as we're living older, there's going to be more of a need to manage chronic disease, right? And so this is one of those diseases. Diabetes is 25% of people over 65 have diabetes, and then 50% have pre-diabetes. So this is definitely something that you need to pay attention to and really key in on as well. Now, something that I want to really discuss here in this video, and you'll notice as I'm speaking about this later on in the coming videos, is that I am not going to give you, the clinician, my colleague, I'm not going to tell you exactly how to take care of your patients, because I respect you all as professionals. If you've gone through school, you're practicing, I'm just going to assume that you know how to basically take care of a patient. But I do want to bring out some good best practices, some clinical pearls, some things that after working with this population for well over a decade, things that have worked well with me, because this is actually one of my favorite populations to take care of. They're a wealth of knowledge, and there is a certain way that you need to approach them to give them dignity and respect. And so what I'm going to do is just kind of share some best practices that I use in my own practice. So let's talk a little bit about our assessment, okay? Our history taking as well as our actual physical assessment. Now, we all know that this is basically how we treat our patients, okay? This is how we figure out what's going on with them, and this is how we, it really guides our care. Now, something to keep in mind when you're doing your assessment with the older adult that has diabetes is not only are we going to clearly key in on the clinical, the medical side of our assessment, but also keep in mind the psychosocial, as well as the social, as well as the functional assessment as well. Now, what do I mean by this? If you just take some time and think about this, statistics have shown us, and again, you can read more about it from the link that I'm going to share in the description box, but this population does deal with more psych issues. There's an increase in depression, even anxiety. You have to understand that, just think about it. A lot of people are coming to the end of life and they're thinking about it. Mortality is something that is probably thought about more than what a 20-year-old would be thinking about. And also, as you live older, a lot of people start to acquire more chronic diseases. People are not as active as they used to be. They're also watching many people around them pass away, friends, family, spouses, some even children, some even parents, and having to deal with that, as well as maybe even possibly being a caregiver to another family member. Many people who may be a caregiver to their spouse, but they're also having their own health challenges as well. That can bring on a lot of psychosocial issues there. And so you have to definitely ask and not be afraid to ask about how they're doing mentally as well. Socially, going back to the fact that people are losing friends and family, you have people who probably, had a circle of friends that is not as big as it used to be. I've come across many patients who they're the last one in their friend group, or they're the last person of their siblings. You have to assess for loneliness. Let's say that maybe they still have friends, but maybe they're not able to drive and get out and about like they used to. That kind of leads us into our functional status as well. Not being able to come and go, as you used to be able to, not be able to do just regular tasks around the house. We get the complaint of fatigue a lot, and having loss of feelings of pleasure, which can go back into depression as well. That's why you have to assess it. But, their functional status is not what it used to be. And so you really do have to assess all of these, because this is going to guide how you treat the patient. What is the care plan for the patient? And also, there are some increased risk of what they call geriatric syndromes. I'm going to read them off here. You have polypharmacy. We know that is something that we see in the older adult. Of course, increased risk for falls, injuries, incontinence, You know, you see that a lot, something that you see that in both male and female, and they have their own reasons why. And so this is something you do have to keep in mind when you're prescribing medicines. Is this going to make them go to the bathroom even more than what they're going through? And if so, what kind of education will come with that? Also, we talked about depression and any cognitive impairment. You will see an increased risk of dementia. You know, you will see patients with dementia, people who are starting to have memory loss. You got to keep that in mind when you start to think about what their plan of care is going to be, because you want to be able to make it as simple as possible. We really should be doing that for all our patients, but this is one of those things where it's very necessary. Also, their frailty and their pain level. This is something that we need to really pay attention to and address, and know that this is a common thing that's going to happen with this population. Not all, but a common thing. So let's talk a little bit about treatment and really how we go about developing our care plan. Now, you've heard me say this before, any current and present literature, you're going to always see that we individualize our goals. You know, at one point in time, and I have seen people take this very literally, that the goal is always less than 7, less than 7, less than 7. Well, quite honestly, that's not across the board, okay? It's not a one size fit all. You do need to individualize your goal. And one thing about the older adult with diabetes, you do have to really take in consideration their frailty. And there's actually like there's a few questionnaires out there where you can assess a person's frailty. If they're like at risk or if they are frail, you would want to relax that goal. Now, overall, typically the A1C goal would be anywhere between 7 to 7.5, but if they are frail or at increased risk, you would really want to have that goal more at an 8. Okay, many reasons is because we don't want hypoglycemia, you know, in our patients. And when people's blood sugars fall, that puts them at risk for falls. That puts them at risk for dementia, you know, which we'll talk about hypoglycemia and dementia at a later time. But those are just some of your basic things you want to consider. And again, a part of that standard, which I'll probably try to pull out the actual chart, but there is actually a chart, a part of the standards, that gives you kind of like a very good visual of like where you would want that person's goal, you know what I'm saying, to be. If a person has cognitive impairment, you're going to need to relax that goal. If they don't have good visual acuity, or if they're frail for any reason, you want to relax that goal. If it's a person who's not very active, if it's a person who can't really probably take care of themselves and have good self-care tendencies, you're going to relax that goal. If it's a person who is not as engaged, meaning that maybe they could do everything for themselves, but they don't want to, or they just are not very adherent, then you want to relax that goal, you know? And so this chart gives a good depiction of what that will look like to give you a good idea for that as well. Something else to keep in mind with the patient that is an older adult and has diabetes is the cardiometabolic status as well. Now, with diabetes, it is considered a cardiometabolic syndrome. And what that basically means is it just is not going to live and affect the endocrine system in the person's blood sugar. It has a strong link and connection with also our cardiovascular system and just our overall body in general. And so there is going to be a lot of screening for cholesterol and doing things that are very heart protective as well. So we're going to be doing a lot of screening for cardiovascular risk, as well as preventing what we can, and then also preventing progression of whatever may already be there as well. Okay guys, that's all I have for you today. Like I said, today is really just giving you a high-level view of the older adult with diabetes. The coming videos, we're going to get a little bit more in depth and talk about specific things. And again, this is not a this is the way you should take care of your patient. This is just giving you some things to think about as you go into your practice, giving you some clinical pearls that I have used and that have been told to me, so you can incorporate these things. If it does not work for you, if it's something you've already been doing, great, okay? But these are just my offerings to you. And also, I'm not going to be talking about the whole kit and caboodle either. I am going to be linking a lot of things I've talked about. I'm going to be linking the standards of care as well as some charts for your further study and for further reading as well if you need a little bit more context. And again, I'm going to also be linking some relevant videos. Like I said, I've made plenty of videos over SDOH. I've made plenty of videos over just some of these same topics that we're talking about. So just really check the description box if you want to learn more about this. Lastly, if you're interested in the Shift documentary, Who Cares? I'm going to link that in the description box as well, so you can go and view that. I really suggest that you do. It's a really great documentary. But anywho, you've been sitting here with Kim E, the Diabetes MP, and I'll catch you on the next video. Bye.